Right. Hi, Lisa. My name's Kelly Pizzaferrato, and I'm going to be your counselor. I just wanted to welcome you to therapy. I know that it might be a little overwhelming or whatnot to come into therapy, and I just wanted to let you know that you made a really big step by doing that. So you should definitely be proud of yourself for doing that because it's a difficult step. So I basically wanted to tell you the approach that I wanted to use with therapy with you. Now, I understand that you have a lot of issues with anxiety as of lately, and the approach that I'm going to use, it's an intervention, and it's called cognitive behavioral therapy. Oftentimes we refer to it as CBT. And what that is we try to delve into your thoughts, your feelings, your behaviors, anything that triggers that anxiety to happen. And we're going to discuss them. We're going to discuss how you feel. We're going to discuss the validity behind it. And more that we talk about it, we're going to discuss basically the negatives and the positives that go behind it. So the whole focus of it is to really emphasize the positives. So whether you're feeling, a negative way with those around you, with yourself, with your environment, the whole goal of CBT is to restructure that so you have a positive, more realistic thought, feeling, behavior. Does that make sense?
Yes, it does.
Okay. All right. So for starters, I wanted to let you know that I took a look through your chart, and I saw that you do have a lot of issues with anxiety as of lately too, because I understand you've had some health issues. So if you'd like to explain that to me, that'd be great.
About a month ago, I ended up in the hospital with pneumonia, and prior to going to the hospital, I was having problems breathing, and I do have COPD.
Okay.
But when I got the pneumonia and I didn't know I had it, it was to the point where I couldn't catch my breath at all. And I even tried my husband's nebulizer medicine.
Okay.
It wasn't working.
Okay.
My rescue inhaler didn't work. And so panicking, and that's where the anxiety kicked in, I couldn't relax to try to breathe in through my nose the proper way and breathe out through my mouth. So it was to the point where my husband had to call the ambulance, and then they had to take me to the hospital. And I was just very nervy and shaken up by that.
Okay.
And I think it's because when you can't breathe, you have to try to tell yourself, just be calm, stay calm. But it's very hard to do.
Oh, absolutely.
And then being in the hospital, just by being in the hospital, I was just my anxieties were very strong. And so that's the problem with anxieties. You can't, when a situation comes up that frightens you, instead of you calmly dealing with it, that's when you can't deal with it. And that's what leads me to here now, is trying to figure out ways that will work for me besides being put on any kind of medication. So.
Okay. Well, thank you for sharing that with me, because I can imagine how scary that probably was.
It was very scary.
And I noticed that you have oxygen on right now. Now, have you always worn oxygen?
No,
or is this...
no. This is something that, since I was in the hospital with this pneumonia, the lung doctor felt that this, right now, best for me to keep on. It's not very strong. It's very low, but hopefully, maybe I can get out of wearing it all the time. Which is another thing, because I'm not very old at all. And I guess I'm embarrassed wearing it. But then I try to look at the positive thing is it's helping me.
That's
so
very true.
That's what I have to look at.
Yes, absolutely.
So.
Okay. That's great. That's wonderful that you're aware that that is a positive, because it's helping you. It's keeping you healthy. It's allowing you to do what you need to do. So I'm sure the oxygen on now helps ease some of that anxiety, correct?
It does. It does, yeah.
Okay.
But I think more of it is, it's hard for me. Because I don't want to wear it. I mean, of course, right now I don't have a choice, but, you feel embarrassed. And I know you shouldn't be embarrassed because other people wear it. I mean,
absolutely.
But it's just something I've got to get used to having on. and working with.
Yes, absolutely. And just like anything in life, it's a process. It's a process to get used to it and to feel comfortable with it.
Right, that's right.
So you definitely have a good outlook in understanding, I might be embarrassed right now, but I know that this is helping me, and I know other people need to utilize oxygen as well. So that's a good thing. And so you definitely have a good start there with, understanding that it's helping you, and you're not the only one that deals with it either.
No.
So in addition to that, you said you came to therapy to help, heal, or not heal, but help treat some of your anxieties.
Right.
Could you elaborate on any other anxieties that you might deal with?
Oh, well, I do have anxieties. If there's anything I'm always, okay, for instance, before I wore the oxygen, and I'm not saying the process isn't going to happen again, but if I had to walk up a flight of stairs, before I would even do that, instantly I would start to I could feel the anxiety level, thinking, okay, why if I can't walk up this flight of stairs? What if I get halfway up and I can't catch my breath? So I would defeat myself before I even tried it. To now where I'm trying to train my breathing, and just not let it overcome me before I try it.
Okay. All right. Yeah, absolutely.
And that's a process I got to work on too.
Exactly. So what it sounds like is, you want to take control of your breathing. You don't want your breathing to control you.
Right, absolutely.
Okay. And, you bring about a really good point about how before you wearing the oxygen and whatnot, before that you would defeat yourself before you could even do anything out of that fear.
Right.
So it's definitely good that you have the oxygen on you now to help secure you, to help you feel safe, that you are able to do that. But then also, any other thing that you're trying to deal with as you're dealing with this could possibly help that as well. Are there other things that you're doing right now to help that?
Do you deal with my anxiety?
To deal with your anxiety, to deal with your breathing.
Well, I just try to keep the proper way of breathing technique. Some of the films that they let me watch with COPD is the different way to breathe, like to breathe in through your nose but out through your mouth with pursed lips, but not, you don't want to just breathe out real hard. You just want to breathe out easy and steady. And if you concentrate enough, you can do it the right way.
Yeah.
And then to try to do that when you're walking. Breathe in for 2 seconds, but breathe out longer. Those are that's one of the techniques which does work pretty well. But you have to concentrate.
Absolutely.
It's not something that you can just do. It's like, and I know once you get used to doing it, it'll become second nature. This is the matter of training yourself to do it and trying to exercise that throughout the course of the day. That kind of thing.
And you brought up getting used to it and training yourself to get used to it. That's a great point that you bring up, because with CBT, essentially what we're doing is trying to retrain those cognitions that you're thinking. So to take it from something negative, like you said in the past, you would defeat yourself before you could walk up the steps. Whereas to now, you're understanding, okay, this is what I have to do.
Well, and I got to look at it too this way. If I start to walk up the steps, and one of the things is, if you're walking up with a group of people, you don't want to be the last one walking up the steps. So I would find myself trying to walk up as quickly as they. The difference is, I couldn't breathe like they did. So that was another thing. So now I just have to say, hey, if you only have to go up 2-3 steps and you have to stop, then you stop. So what? They can walk around you. But that's the attitude I have to take, because, you can't get yourself worked up.
Absolutely.
It just makes it worse.
Absolutely. I mean, and that's great that you bring that up, because you're understanding that sometimes it does take certain adjustments, and sometimes you have to take that step back. And I think a big thing that we practice throughout therapy is whenever you feel that anxiety coming on, you take a step back and you almost ground yourself. So it seems like you kind of have a good grasp on that already.
Well, I have a grasp on it, but I don't necessarily do it the right way.
But like we said, it takes practice.
Yes,
it definitely does for it to become second nature for you. Yes. So is there anything else that you'd like to discuss with your anxiety?
No. I just want to be able to not always be fearful of that. And for the longest time, I wouldn't go to see about my breathing.
Okay.
Mainly out of fear.
Okay.
Going to the doctor. Then I'd established myself going to a regular doctor, but he also wanted me to see a lung doctor. And I kept putting off and putting off. And so, till this happened, and I had no choice.
So it was a scare almost.
Yeah. And it's my fault. Had I not gone sooner, I may not be wearing this.
Well, the thing with that is that's in your past, and you don't know what could have happened. You don't know how the events could have happened.
That's true.
You don't know how they could have transpired. But the good thing is that you're focusing on it now. And you have your oxygen on, and you're coming to therapy, and it seems like you're very focused on trying to fix that anxiety that you feel plagues you, which is excellent. You're in a very good spot because I can tell that you're very eager to continue to work towards it, which is it's great. That's great to see. So basically, to end this session, I mean, I do think you're in a great spot. I do think that, like I said, I think you have that confidence and that drive in order to handle your anxiety and to take them head on. So that's what we're going to do. We're going to work on it together. We're going to be, a system of support. So, I can continue to encourage you so that you're able to do that and you're able to see, okay, if I take a step back, if I do this, if I adjust this a little bit, if it becomes a part of my routine, then it's going to become second nature for you.
Right. That's right.
And you're no longer going to be plagued by the anxiety and the fear and defeating yourself before it even happens.
That's right.
So I definitely think you're off to a great start, and I definitely feel that it was a good idea that you came here today because, like I said, you realize a lot of things already. You understand what you need to do, and I'm going to be a system of support for you, and I'm going to continue to encourage that. And every now and then you might have a little homework for me to do. Don't worry, I won't have you write anything down, but, for every session, I might tell you, hey, Lisa, I need you to do this until the next time that we meet again. And then when you come back, we'll talk about it, and you'll explain to me how you feel, and you'll explain, did it bring on any fears? Did it bring on any irrational thoughts? What was your behavior in handling it? Where was your anxiety level at? And then the further that we go with it, we're going to learn about more things. They're called grounding techniques. And we're just going to see, in addition to, once you conquer a lot of the issues with the breathing and the fear and whatnot, I'm going to give you some tips on how to ground yourself if, say, anxiety just overcomes and you're doing everything that you know that you can do. There's going to be little things here and there that I'm going to introduce to you that you're going to be able to establish throughout your life, from here on out. So, like I said, I definitely think you're at a great start, and I definitely look forward to continuing to work with you. And for sure, let's continue this, and you continue that positive attitude. I can definitely see from what you've explained to what it was a few years ago to now, it definitely seems like you have a different type of thinking. So we should definitely continue to work on that. But other than that, I'm very impressed with the progress that you've made so far, and I'm really excited for us to work together.
Well, thank you.
Okay?
Okay.
All right. Thanks, Lisa.
All righty. Bye-bye.
Bye.